Information sharing is crucial in terms of the delivery of healthcare to individual patients. Most patients are surprised that we don't share information than we currently do. My view is that the role of the Call to Guardian is very much to make sure that we appropriately use clinical information about patients, but within secure channels. In other words, we can't be responsible for making mistakes with the data. Individual clinicians don't make mistakes deliberately. They happen because of system and process failures. What I like about Guru is that this gives us a channel for the secure transmission of sensitive personal data, and that's got to help with patient care. Really, it's as simple as that.
I would definitely recommend Guru to other acute healthcare organisations that need access to GP data in their organisations. It makes it a lot faster and a lot easier, and all trusts where they can use Guru to access GP information would be well advised to use Microtest for that.
We ideally love working with Microtest because they are a local company here in Cornwall. They also supply over 50% of our primary care practices, and being a smaller niche organisation, they are very quick to step up to the plate with changes and requirements we want as commissioners for our patients in Cornwall.
It's a very individual service, really good support. It's a smaller company, so you are a person rather than just a number in a big setup, so you do get very good service.
I like working with Microtest because it's a local company and it's got a very good reputation, and it's also got a national reputation for delivering high quality products for GPs. We've got a great GP medical record system and some great systems through Microtest and Evolution for sharing information with other practices such as the LOR service.
I find that the support and help, the help desk and the engineers that get sent out excellent. They tend to resolve our problems very, very quickly and they're very efficient when they come. I also think their engineers certainly are really friendly and go above and beyond the call when coming down to work with surgery.
Guru we use a lot here in Cornwall, and we're going to expand the usage. It was interesting being a patient myself that I attended a hospital, and the hospital was only 1 mile away from my GP, but the hospital knew nothing about my GP record. So therefore we had a discussion with primary care, with our own commissioners and the acute providers, and said wouldn't it be sensible that we actually had access to the right information about the right patient at the right time at the point of care. It was a bit like a light bulb moment where everybody jumped on, and now we're very pleased to say we now have access to primary care records from our acute offices.
Evolution is a great benefit to practices because it's simple and intuitive, it's quite straightforward to use once you become familiar with the various screens. It's good quality for recording important clinical information, and in the background it's got all those checking systems and systems for integrating medical information into document templates and for sharing information with hospitals and other practices.
The main benefit of having access to Guru at the hospital for us, for the pharmacy team, is that we're able to quickly and reliably access patients' medicines information directly from their GP practice without contacting the GP practice itself, which significantly helps efficiency and speed of that process, which helps us with medicines reconciliation, and in turn then makes the patient much safer in our care because we can make sure that we've got the patient's medicines prescribed appropriately when they come in to see us in hospital.
We've been able to adapt the system to our specific needs. We're a total triage practice, which is different from other surgeries. So we've been able to do things such as colour coding, which has helped our doctors and our receptionists. We've used workflow, which has saved an enormous amount of data time and with it money. We use things such as FastVac and the brother scanners that we come with it. All of it has really helped make us a much more efficient and streamlined practice.
Microtest has a great reputation for customer service. We get a friendly, helpful service, and when we've had issues, we've had good response.
Also working in commissioning, we look at the 5-year strategic plan, and the NHS is driving more about patients being treated closer to their homes. It's all about care at the point of care. What we're trying to avoid is have patients travelling dozens of miles, if not longer, sitting for hours waiting for appointments when it could be done near their homes, in care homes, in local community settings, rather than at an acute or another provider. Therefore, we're trying to use a product that gives us access to all the information at the right time and the right place, and Guru is that start of the programme. We started very small. As you know, we started in the Penwith area. That's now going K2 wide. We're now looking at our Devon colleagues to help them access records for patients in Cornwall that go to Devon. We're also looking at the ambulance services, the out-of-hours services, the logical care at the point of care locations.
We use Evolution as our main IT healthcare facility at Cape Cornwall Surgery, which is a training practice, and that's used every single day, and it's an effective system, which is safe for patients and for doctors. And for Guru, we'll be using it as a clinical governance umbrella for our clinical research unit, so that I can look at patient notes from practices elsewhere around about West Cornwall in a safe manner with appropriate password cover and protection.
Evolution's helped us hit reasonably good targets in terms of QOF, but it's the main thing is that it improves patient care. Quality and safety of patient care has been very important.
In particular, QOF. We generally we've always had 100% of our QOF targets. We generally try to do it by December or January. Evolution has been essential to us being able to do that.
We have occasional power surgeries and power cuts at St Just in West Penwith, but invariably our IT system is spared. But I can't remember the time when we realised we're complete without a computer system at Cape Cornwall Surgery.